Truncus arteriosus is a rare congenital heart defect in which a single blood vessel, the truncus arteriosus, emerges from the heart instead of the normal two separate vessels, the pulmonary artery and the aorta. This condition is present at birth and occurs due to improper development of the fetal heart during pregnancy. It results in oxygen-rich and oxygen-poor blood mixing together, which can lead to inadequate oxygen delivery to the body. Key features: 1. Single outflow tract, instead of two distinct vessels, aorta and pulmonary artery. There is a single vessel arising from the heart. 2. Ventricular septal defect (VSD), a hole in the wall septum separating the two ventricles, allowing blood from both chambers to mix. 3. Valve abnormalities. The truncal vessel is typically associated with a single abnormal truncal valve, which can have multiple leaflets and may not function properly. Symptoms. Babies born with Truncus arteriosus often show symptoms within the first few days or weeks of life: cyanosis, bluish skin due to low oxygen levels, rapid breathing, poor feeding, and weight gain. Fatigue, heart murmur, abnormal heart sound. Diagnosis typically involves echocardiography, ultrasound of the heart, main imaging tool to confirm the diagnosis. Chest X-ray may show an enlarged heart and increased pulmonary blood flow. Electrocardiogram (ECG) detects abnormal heart rhythms, cardiac catheterization, or advanced imaging e.g. CT, MRI sometimes needed for detailed anatomy. Treatment: surgical repair is the only effective treatment and involves 1. VSD repair, closing the hole between the ventricles. 2. Separation of blood flow, dividing the truncus arteriosus into two vessels. A tube or conduit is used to connect the right ventricle to the pulmonary arteries. The truncus arteriosus is reshaped to function as the aorta. Surgery is typically performed within the first few weeks of life. Lifelong follow-up is necessary to monitor for complications such as conduit replacement as the child grows or truncal valve issues. Prognosis: with timely surgical intervention and proper management, many individuals with Truncus arteriosus can lead relatively normal lives. However, ongoing care by a cardiologist specialized in congenital heart defects is crucial.